Hello and welcome. This video is a guide on how to use the Chronic Lung Disease and Asthma report in primary sense. Please note that any data that you see is dummy data and not real patient data. The report was designed to identify patients older than 14 years with a coded diagnosis of a chronic lung condition and/or asthma, and who have at least one recorded consultation, reason for visit or diagnosis, or have been prescribed medication within 18 months of the date of this report for a chronic lung condition. To open the Chronic Lung Disease and Asthma report in primary sense, go to the desktop application and click on Reports. This screen shows all the current available reports in primary sense. From this screen, double-click on the Chronic Lung Disease and Asthma report. This report will then open in your default browser. What you see now is a demo version of the Chronic Lung Disease and Asthma report in primary sense. This report will look different for you as your practice will have more patient data. To help you understand the report, there are these 4 tabs which contain further information. The first tab contains information on which patients are included in the report. The second tab contains information on the data that is in the report. The third tab explains how do you use the report. And the fourth tab explains what are the ACG patient complexity levels. The report also provides a synopsis, which shows patients with COPD diagnosis in the practice across 30-day intervals. So now let's take a closer look at the Chronic Lung Disease and Asthma report. Scrolling down, you'll now see the data. In any primary sense report, you can click on any of these headers and the data will sort for you. So if you wish to sort by diagnosis, simply click the diagnosis once and it has now sorted alphabetically. If you wanted to sort by age, click on age and it has now sorted your patients by youngest to oldest. If you click on it again, it'll sort by oldest to youngest. Any of these headers can be selected to sort. Now let's work our way through the report from left to right. The first column is Remove. By clicking that, you will remove the patient from appearing in this report for the next 12 months. Next up is the ACG score of the patient. This is their complexity score as defined by the Johns Hopkins ACG tool. To learn more about the ACG tool, simply click on this box here, which will describe the ACG tool. Next, we have the patient's name, the patient's phone number, the date of the last visit to the practice, if the patient has any existing appointments, their usual GP, the clinic the patient attends, the patient's age, and Aboriginal and Torres Strait Islander status. Following on from this, the last 6 columns include patient information obtained from coding in your clinical information system. So here we have the patient's chronic lung or disease diagnosis, the patient's smoking status, and more information on this column can be found under this heading here. Also includes the history of cessation medication, history of Menunovax, and the patient's history of Fluvax. But please always check the patient's immunisation record via the Australian Immunisation Register or AIR before administering any vaccinations. And the last column is the date a patient last received a spirometry test. Spirometry test date is coded by the last time a patient was billed a spirometry test in the practice. If your practice does not conduct spirometry testing, then this date might be inaccurate. So please check the patient's medical record in your clinical information software for an up-to-date spirometry test date. Each report can also be exported to an Excel file to filter the report in more detail, or export it to a CSV file for SMX functionality. So let's take a closer look to identify patients from the report with COPD. We will export to Excel and press cancel. So once this has downloaded, we will open this report in Excel. So from here, you will need to enable editing on the Excel spreadsheet. You will then need to remove this top line by right-clicking the first column and pressing delete. You will then need to apply a filter by coming up to sort and filter and press filter. Now, the easiest way to sort your patients for a COPD diagnosis is to click the filter button here, go to text fillers, and click on contains. Now you type COPD and press OK. So now you will see I have a list of patients that have COPD as well as other chronic lung or asthma. You can also sort these by A to Z, which will then alphabetically sort this list for you. If you have any questions or would like to learn more about Primary Sense, please contact your local primary health network.